And, and it's such a great privilege to come back to the college days, to be with the youngsters, young minds. And this is something which in the pandemic is very much necessary now that very much things are in a dilemma. Physical health, mental health is quite being affected in this period of time. The whole world is looking towards our spiritual sciences and yoga with great hopes. So I'm very grateful to the Department of Swasthvritta too for arranging this program, which will definitely be helpful for our students. I think all the great speakers before have definitely might have emphasized on this. So today, let's start with the topic that we have, that is yoga for preventive cardiac health. So to begin with, rather than going into the routine traditional form of, okay, we have cardiac problems, we have diseases, and then which are the asanas, pranayam, and practices that we have to do. We will go in a more traditional way. So first, we will calm down ourselves with the prayer of Lord Patanjali, and then we will begin with our session. So I will welcome everyone to place their palms on your knees, eyes closed. Relax and deep, long breaths. When your breaths are calm and relaxed, we will chant Om 3 times. Observe the vibrations flowing throughout the body. Last time inhale. Absorb the peace and the silence of home. When you feel the lightness of thoughts, calmness in your body, and relaxation, gently we'll fold our palms. Deep inhalation, we'll start with the prayer. Yogena chittasya padena vacha malam sharirasya cha vaidakena yopakarottam pravaram amina patanjalim pranjaliranatosmi. The gentle smile on your face. Rub your palms. Place your warm palms on your eyes. Slowly open your eyes behind your closed palms. Let the light enter your eyes. From the darkness of ego, we're moving toward the lightness of knowledge and humility. Namaste. Thank you. So, with this contemplation and the beautiful chanting of Om, we are starting with today's session, that is yoga for cardiac health. Now, why all these practices that we do are very important, and why not to jump directly into the asana practices and the pranayam techniques is very, very important. That's what we are also going to see in the later part of different kind of researches which have been published. Before we go towards management of cardiac health, let's try to understand yoga through different perspectives, because our traditional notions of yoga are quite different, and the science of yoga is not only objective but has a lot of subjective parameters also. And that's the reason a lot of people who are benefited out of yoga, it's not only that they get yoga is not a tool that only solves your problems, but yoga is something that helps you or enables you to look towards your problems with different attitude, different perspective. And that is something which has helped millions of people across the globe. With the International Yoga Day coming in, nearing in, we have yoga, which is being celebrated across the world. So let's, as this is our cultural heritage, let's understand what are the deeper aspects of this particular science. Okay. So when you see this particular image in front of you, most of the time, you feel that one, maybe a guy who looks like an Indian would be a yogi, or maybe you might feel because someone is doing a pose some better than someone else, you will feel someone is a yogi, a better yogi. But that's what is a perception which we need to change. We need to understand and go in the depths. If asked who is a yogi, that is what is there in the slide. So we might have our answers based on these kind of assumptions. But that is what might change if you see the next slide. Because if you just go inside, what matters the most in yoga is not only what you do from outside, whether you close your eyes and sit in a meditative pose, or whether you have a smile on your face from outside, that is not the only thing that matters. But what matters is, even though you have a smile outside, do you really are enjoying and in a state of peace and calmness from within? That's important. You are enjoying the best delicacies and the food, but are you really eating the best of the best vegan, highly nutritious, organic food? Or are you able to enjoy that each and every morsel that you're putting in? That is what determines whether you are yogi or not. And that's what getting inside a mind of a person is quite difficult. And if you get into the mind of people, you'll understand, though people who are enjoying from outside, having beautiful Instagram and Facebook photos, yeah, flashing, which envy other people. You really feel people going at very exotic, fancy places, dining out at fancy places, enjoying life with friends, families, and you feel they are the most happiest people. But that's not always, because what you find from outside might be a delusion. And that's what yoga is all about. What you see today in the field of yoga around on Facebook and social media might not necessarily mean that is yoga. Okay. So for understanding what is yoga, you have to get into the mind of a person. And that's where Patanjali, the father of yoga, talks about that yoga is chitta vritti nirodh. योग ही अशी गोष्ट आहे की ज्याच्यामुळे मनातले सगळे विचार शांत होतात. विचार, अनावश्यक विचार मनातून बाहेर काढणे, ह्या ऍक्टिव्हिटीला किंवा या क्रियेला योग असं म्हटलं जातं, according to Patanjali. And that is something which is very, very important, and people are not able to do it. And that's the reason they're suffering from cardiac health and other problems. That is what we are going to see. I'm not able to handle my work pressure. I'm not able to cope up with the stress created because of the constant fights in my family. I am not able to cope up with the stress कारण माझी झोप व्यवस्थित होत नाहीये. सतत छोट्या छोट्या गोष्टी मला त्रास देतात आहे. आज बॅटरी लो झाली किंवा all these kind of small things, nagging things is creating stress, and that's the reason we are having cardiac problems, whether it is hypertension or whether it is heart attack in the form of AMI, angina, and all these kind of different coronary artery diseases also. And in this context, it's very important for us to go back into the core principles of yoga and try to understand how this philosophy of yoga can create a change in the mind of the patients. And this mental change and attitude can really be very crucial in attaining health. कारण स्वास्थ्याची आपल्याकडे जी काही व्याख्या केली आहे, समदोष, समाग्निश्च, समधातू, मलक्रिया, या सगळ्या गोष्टी सांगितल्यात स्वास्थ्यामध्ये. पण त्याच्या पुढच्या गोष्टी कुठेतरी आयुर्वेदामध्ये आपण ऍज अ डॉक्टर किंवा वैद्य म्हणून खूप साऱ्या वेळेला पेशंट बरोबर आपलं कोलॅबोरेशन त्या गोष्टींवरती तेवढा एम्फसिस होतो का, हा प्रश्न आपण स्वतःला विचारायला पाहिजे. अँड दॅट ऍस्पेक्ट इज प्रसन्न आत्मा इंद्रिय मनः स्वस्थ इति अभिधीयते. सो आत्मा, आर वी engaging our patient actively in his or her own treatment? Is he conscious about what are the things that he is going in the process? इंद्रियांमध्ये आपण पुढे बघणारच आहोत की पॉझिटिव्ह फॅक्टर्स मध्ये मग अल्कोहोल, स्मोकिंग म्हणा किंवा या सगळ्या गोष्टी आपल्या रोजच्या जीवनशैलीच्या ज्या गोष्टी आहेत त्या इंद्रियांवरती, इंद्रिय खुश नसल्यामुळे ते इंद्रिय नको त्या मार्गामध्ये जातात. आणि दॅट इज वेअर वी हॅव ऑल दिस काइंड ऑफ ॲडिक्शन्स कमिंग इन. सो प्रसन्न इंद्रिय आहेत का? इंद्रिय प्रसन्न जर असतील तर ते अशा प्रकारे डिस्ट्रॅक्शन्स मध्ये जाणार नाहीत, ज्याचा तुमच्या आरोग्यावरती खूप विपरीत परिणाम पण होतो. The last important thing is प्रसन्न मन. मन आनंदी आहे का, हा एक खूप महत्वाचा घटक आहे. ज्यावेळेस आपण कुठले मॅनेजमेंट थेरपी ह्या विषयामध्ये जेव्हा आपण लक्ष घालतो, तर जोपर्यंत कन्झ्युमर किंवा तो पेशंट, तो जी काही व्यक्ती आहे ज्या ह्या सगळ्या प्रॅक्टिसेस करते, सूर्यनमस्कार करते, आसन करते, प्राणायाम करते, तर ह्या सगळ्या गोष्टी करत असताना ती व्यक्ती फिजिकलीच फक्त त्याच्यात आहे का, ती मनापासून आत्म्यापासून ती गोष्ट एन्जॉय करते. दिस इज समथिंग विच इज व्हेरी इम्पॉर्टंट. So moving towards our next segment, because of the kind of awareness in different kind of media that we have, everybody knows, म्हणजे हार्वर्ड पासून in all the major medical schools, such kind of researches are going on that how yoga is affecting and very much beneficial in different health conditions. And that's why again a lot of curiosity has been developed. But when we are understanding this aspect, we also have the other side. In a lot of media around, in different journals, it was very interesting and not very heartening also to understand when I read one of a research paper of American Orthopedic Association. त्याच्यामध्ये असं दिलं होतं की त्यांनी अमेरिकन लोकांना जे काही मस्क्युलोस्केलेटल ज्या काही इंजुरीज होतात त्याचे पहिले 10 घटक सांगितले होते. आणि त्याच्यामध्ये in the first 3 what the problem was, the first was definitely road traffic accidents. But what was shocking is this, in the second position, we had yoga related injuries. Okay. So, and yoga related injuries was not also the term coined. The second word was written as yoga. So yoga directly, they didn't say yoga related injuries, but it's like directly yoga was blamed for all the musculoskeletal problems. So that is how I also want to make you aware that yes, yoga is good, but as we have seen in Hatha Yoga Pradipika, they say yukta abhyasa yogena pranayam sarva rog kshay bhishet. So pranayam, yoga practices when done in a right way, to the right person, taught in a right way, म्हणूनच गुरु उपदिष्टम, under the supervision of an expert, ज्यावेळेस या सगळ्या गोष्टी केल्या जातात, especially when you have heart conditions and all this kind of complicated problems people suffering from with multiple other things, comorbid conditions. It's not only a person has high blood pressure or hypertension, he has some other problems also. Like for example, he might be having diabetes, he might be having kidney failure, multiple problems together. So in these situations, it's very important that we as doctors, we as yoga teachers, see to it that we have a holistic integrative approach and safety is given the first priority, because do no harm is what something we have to believe in. त्याला आपण अपुनर्भव चिकित्सा म्हणतो, की ज्याच्यामुळे आपण जी काही गोष्ट करतोय ज्याच्यामुळे पेशंटच्या डेफिनेटली क्वालिटी ऑफ लाईफ आणि इम्प्रूव्हमेंट मध्ये फायदा व्हायला पाहिजे, पण पेशंटला एकदा बरं वाटलं की परत ती पर्टिक्युलर प्रॅक्टिस, औषधं किंवा ती पर्टिक्युलर त्या ऍक्टिव्हिटीज बंद झाल्यानंतर परत तसाच त्रास परत होऊ नये म्हणून पण काळजी घेतली पाहिजे. So let's understand what kind of approach we are going to have based on this template. And this template is given by Maharishi Patanjali in his Yoga Sutras. It's called as the 4H template, which is very much important for doctors whenever they are trying to have any kind of management as far as yoga is concerned. So not only yoga, but any kind of problem in your life. And I think this fits very much well. So here is understanding the disease or the problem. बऱ्याच वेळा पतंजलींनी हे सांगायचा प्रयत्न केलेला की तुम्ही एक रॅन्डम सर्वे केला आणि लोकांना विचारलं तुम्ही खुश आहात का, तर बरेच जण म्हणतात नाही जे म्हणतात त्यांना जर विचारलं तर का खुश नाहीये, तर ह्याचं उत्तर बऱ्याच जणांना सांगता येतं. Even the heart patients, what we are having yoga for cardiac health, yes, you can have, whenever you are trying to have these kind of yoga practices for them, ask this random question and you will be very much shocked to understand that most of the people who are either angry, frustrated, irritated with life, they don't know what exactly is making them frustrated or irritated. So that's what understanding the problem is the main thing. So try to have this kind of a methodological approach whenever you are going for some kind of yoga intervention into your patients. Okay, this will help you in filling up all the gaps and having a holistic approach. So understanding the disease, understanding the person, that's why in Ayurveda we have so much of emphasis on not only what is the disease of the person, but who is this person. Prakriti assessment is also very important. That is also important whenever you are going for management, because whenever you are trying to implement yoga practices, okay, Surya Namaskar, Vat Prakriticha माणसाला, if you have heart disease patients, okay, so heart disease patients of Vata Prakriti, Pitta Prakriti, Kapha Prakriti, प्रत्येकामध्ये तुम्ही सूर्य नमस्कार कशा प्रकारे इंट्रोड्यूस करणार आहात, कुठली आसनं कशा प्रकारे इंट्रोड्यूस करणार आहात, that is also going to carry a lot of importance. So that's what understanding the person, his problems is very important. That is Heya. The next factor comes Heya Hetu. Why exactly this kind of problem has occurred? That we call it as risk factors. And again, there we would be seeing different kind of approaches, how these heart diseases are created. Next is ultimately we are going to move towards Swasthvritta. So to achieve this Swasthvritta, how different kind of yoga practices are going to be helpful, that we consider as Anubhai. So remember this template, it is very important for all the different kind of management things. Now, I think now when you have come into the third year of your college, you definitely know what is NCDs. And that's what now we have COVID, but even though we have COVID, still NCDs are playing a very important role. Many people are dying not only because of COVID, but because of these complications. And the most problematic killers are diseases, the number one. Then you also have stroke, diabetes, its complications are one of the common killers of this world. And so in this context, we have to understand what exactly yoga can give for us and our people. So today's topic is heart diseases, which is considered to be the Heya. So in heart disease also, we have different types of heart diseases. Sometimes it's like the coronary arteries, the blood supply which is being done to the heart is being choked up. Now, how and why it gets choked up, we will see soon. And then we will also understand how different practices of yoga, whether they are asanas and other conventional practices, or there could be some kind of modifications in the thought process and behavior and personality that can help in reducing these kind of problems of atherosclerosis. Okay. So that we will see sometimes the walls are not functioning well. Sometimes infections happen in rheumatic heart diseases and all these things can also take place. Sometimes the electrical activity gets derailed like arrhythmias and all this. So together all this come under the umbrella of heart diseases, and there could be different factors like hypertension and others which are more, which make this worsen. Okay. So without going much into the depths, what is hypertension? Basically, when your blood pressure is more than 140/90, that is considered to be hypertension. There are different stages. Per se, hypertension itself is not very much symptomatic. You don't have much amount of symptoms. Rarely some people have headache or some kind of, and that's the reason why people neglect this condition a lot. And that in yoga can be considered as avidya. Ignorance is one of the most important reason for hypertension getting into complications. Like when your blood pressure inside your blood vessels is high, directly it doesn't cause any problem, but for long standing, it creates problems like the capillaries or the blood vessels inside your brain gets a point of hemorrhage where you lead to stroke, paralysis. You get the same kind of problem with heart attack, kidney failures, and all these complications occur. But why a patient goes into all these kind of complications, the important reason is that a lot of time people are unaware that a simple thing like consistent high blood pressure can lead into these complications. So this kind of problem in yoga is called as avidya. Lack of education, awareness, determines the actions of people. That's the reason why people are very careless. Most of the time, even if you educate, not like every person will change. Okay, even if that's what happens. Even as a doctor, if you educate a person, what are the complications of hypertension? Still, there are some people who don't take it seriously unless and until they fall ill, sick, they get some kind of stroke, paralysis, they land up into ICU. So that's again another reason. And this is called as ego, or this is called as asmita in yoga. So Patanjali says that according to the Yoga Sutras, there are 5 reasons why we suffer. And these are very much perfectly applied to the cardiac diseases, for the heart diseases. As I talked about, everybody knows, there are few people who do not know that eating too much of oily things, sitting leads to obesity, and that leads to hypertension and heart diseases. So for some people, if you just educate them, that is enough. But not all people can be benefited with this. For example, if it would have been so easy that smoking kills, smoking leads to heart diseases, then just by reading the wrapper or whatever was written in the covers, people would have stopped smoking. But it's not so easy. And so what are the reasons why people do not stop smoking? So there they have said that sometimes it's the ego, because the patients don't want to take an advice from the doctors. Anybody tells you something good and you're like, who are you to tell me this? So that kind of ego prevents you, even if the advice is good, you don't like to take the advice because your ego is hurt in that. So that's another reason why people, and such kind of, and this later on becomes your tendency. And you will find that this kind of tendency of people, like further, I will just show you, I will just skip some slides. This is a typical kind of tendency of people who are more prone for heart diseases, who have this kind of ego that taking any advice from someone will hurt them. And this typically are called as type A personality people. Research has shown that they are so kind of rigid that they will apply. For example, this is an engineer who is cooking. So he is trying to apply his engineering even. And so you can understand what kind of dish he is going to prepare and how much time it is going to take, and what kind of atmosphere is going to happen with the family members. Yeah. So these people never like to listen to anyone. They keep on moving. And this kind of attitude gives them rigidity. And this rigidity is linked to something which is in cardiac problems is called as arteriosclerosis. So what happens in this arteriosclerosis? If you have a green stem, it is very elastic. Okay. But if you have a dry stem, if you try to bend it, it will break. So that is what happens to your heart vessels, okay, blood vessels into your heart, because of different factors. It could be lack of exercise, lack of yoga practices, lack of meditation, too much of aggression, and lack of mental, emotional control, self-control. It leads to rigidity. Okay, again, faulty eating practices, dietary behavior, high levels of lipids. These are also some of the other factors that creates rigidity in your blood vessels. But the most important concept is your mind. When your thoughts are very rigid, you have a great amount of ego. These are the people who are concerned with this problem of arteriosclerosis. And because of this rigidity, suddenly when you have hypertension and all these things, you have heart attack coming in. So you can understand how much yoga talks about chitta vritti nirodh, yoga talks about samatvam yoga uchyate, balance and mental calmness, relaxation, how it is important in yoga, in the management of different kind of problems. Because we are seeing nowadays, it's engineering college students, medical college students, students who are getting hypertension, students who are popping up pills, students who have to take insulin shots, and they are moving towards heart attacks, yeah, and all these complications. So it's not a very good sign where these kind of problems, cardiac health and all these things, issues were discussed for people above 60 few decades before. Now it is so common that even in the youths, we have this. So we have to understand what is it. And mental factors, mental health is very much important, which is determining a role in this kind of rise, exponential rise in cardiac patients. Okay. And this is just a small kind of a cartoon, but we will all agree that we are in this kind of state of mind, completely restless state of mind. So what are these type A personality people who are, they say that these type A personality people have 70% more chances of having diabetes and heart diseases. Okay. So imagine this is a man who is in the office. So in the office, instead of working, what he does is he's constantly thinking about how he's going to play golf with his friends in the afternoon. When he is with the friends playing, he's just imagining what is going to happen in the night. It's going to be wonderful. When he's in the bed, he's thinking about, he's stressed up with the kind of work because he couldn't complete his work in the morning. He's stressed up with the kind of work. And this kind of personality of the people are more vulnerable to have such kind of problems of arteriosclerosis and atherosclerosis. Again, atherosclerosis is a component where, because you have too much of oil and all this kind of content in your food, slowly and gradually your blood vessels start choking up. So the lumen through which your blood is passing slowly and gradually gets reducing day by day. And there are different reasons for that. No physical activity, too much of sedentary lifestyle, too much of sitting. Yeah, with the work from home coming in, you might have seen a lot of people having a lot of back pain, neck pain, eye related problems. So this is very much at high. So such kind of deposition of the cholesterols closes the arteries, and at one point, what happens is suddenly there is a rupture of the lumen, the blood vessels, because of the rupture of the clots. What happens is the blood vessels completely get choked up, and the blood supply to the heart is stopped. And partially, if it is stopped, it's called as angina. If still the heart is, if it is stopped completely, then you have myocardial infarction. One important reason why this kind of deposition gets into is smoking. And that's what we have to understand. If somebody is smoking, you cannot just say, okay, stop smoking. It's very important to understand what are the triggers that make him smoke. And unless and until you stop those triggers, it's not possible that the person might come out. It's not possible that the person might leave alcohol. Alcohol, smoking are very important triggers for these kind of problems of atherosclerosis. And one beautiful thing is we have found out that the research, evidence-based research has shown that normally it takes 15 years for a person for his heart to get back to the normal condition after quitting smoking. So if you stop, it will take 15 years for you. But if you regularly practice yoga, okay, regularly means every day, not like once a week or once a month. Regularly is every day. That's called as abhyas. So to dirghakal, nairantar, and satkara savita means you have to believe in what you're doing. So if such kind of a yoga practices are done daily, it has been found out that the negative effects on your heart of smoking can be reduced immediately in 2 years rather than normally it taking 15 years. So this is how beautiful yoga practices can work. But again, I said it will take 2 years. Unfortunately, there are such kind of patients and people around us that even 2 years is something like they don't want it. And then it's very difficult for us to make them understand and convince that how these practices are helping them and going to be beneficial in the long term. Yeah, because whenever you have a particular problem being created, you get the symptoms very late. But the problem, the process of disease creation had been started long before. It's something like an iceberg. What you see at the tip of the iceberg are the symptoms of the disease. But the creation of the disease has started many, many years before. And so when you want to have any kind of management or results of especially practices like yoga, which are very, which work from its root cause. So such kind of practices start working. And for that, you need to understand a concept which is called as Panchakosh. So they start working from your inner dimensions, which are like the Anandamaya Kosha, Vijnanamaya Kosha, Manomaya Kosha. And that's the reason, because it takes time, okay, to come out, to find some kind of results as far as the symptoms are concerned. And so you have to make people understand that yoga practices, though they are very slow, they are very much helpful in the long term. Physical results, maybe you might take a little time, sometimes not exact, not it's like every time it will take time, but sometimes you need to have patience. Some people get physical benefits quite early. Some people are not very much mindful and conscious, so they find that it's taking much time, but it doesn't mean that yoga is not helping. They say yoga bhavati dukkha. In Bhagavad Gita, it is said that yoga will never let you down. Why? But before that, they have a prerequisite. What is that? Yukta ahar viharascha. Yukta means proper, appropriate. So if you have your diet, vihar is your day-to-day activities, your dinacharya in balance. And that's very common sense. If your work-life balance is established, that's we call it as in brahmacharya. So yukta ahar viharascha, yukta cheshtasya karmasu. If your actions are also in a state of balance. Yukta swapna abodhasya. That we have also seen. Insomnia, that's what we are going to see tomorrow. Insomnia, sleep disturbances are also creating a very great amount of negative impact, whether it's diabetic patients are concerned, heart disease patients are concerned. All this affects us. So when Bhagavad Gita, it has been said that if you are following all these things in a right, appropriate way, then yoga bhavati dukkha, yoga can take you out of all the problems. And that's what is important. It's a key Chikitsa Sutra in yoga for cardiac patients, that if you are making a kind of a lifestyle modification in the patient, then definitely your patient is going to be benefited sooner or later. Yeah. And if not, if there are some impatient patients and which you don't sensitize them, don't educate them, who are only on obsessed with some kind of quick results, with some quick asanas or quick sun salutations, then you have to make them understand that, okay, they quit after 5, 10, 15 days. Okay, it's not working for me. ह्याचा काहीच फायदा होत नाहीये. मी 5 दिवस आलोय, अजून माझं वजन कमी नाही झालेलं. मी आता 10 दिवस येतोय, अजून माझं इन्सुलिन लेवल कंट्रोल मध्ये आली नाहीये. काय योगाचा काहीच फरक पडत नाही. असे जे म्हणणारे लोक आहेत, त्यांच्यासाठी एक अमेरिकन हार्ट असोसिएशनचा एक रिझल्ट आहे, की जे लोक आयसीयू मध्ये जे अँजिओप्लास्टी वगैरे ज्यांची होती, ज्यांना हार्ट अटॅक येऊन गेलेला आहे, अशा लोकांना अशी 50% लोक हे 5 वर्षापेक्षा जास्त जगणार नाहीत. So we have to understand those who say की मला काय होत नाही, हायपरटेन्शनने मला काय त्रास होत नाहीये, ओके, डॉक्टर नुसतं घाबरवायला सांगतात, अशा लोकांना या गोष्टी सर्वात महत्वाच्या आहेत की आज तुम्हाला काय होत नाही असं तुम्हाला वाटतंय, पण ऍट द below the water in the iceberg, a lot of problems are there. And just because they do not surface up, ते पाण्याच्या बाहेर आलेले नाहीयेत म्हणून तुम्हाला असं वाटतं की प्रॉब्लेम नाहीये, प्रॉब्लेम आहेत. त्यामुळे रेग्युलर प्रॅक्टिसेस ऑफ योगा very important, because they not only keep you physically healthy, they are also important to keep your mind in a state of perfect bliss and balance. Okay. So after understanding a little bit about the cardiac problems, hypertension and all, we will now move towards its management. Okay. So what kind of management techniques are there in yoga? What we know as management techniques in yoga are only the tip of the iceberg. Okay. And म्हणून प्रत्येक वेळी like even that is what I have this kind of experience. कोणी भेटलं आणि एव्हरीबडी, तुम्हालाही असा अनुभव आला असेल, कोणी तुम्हाला भेटलं आणि तुम्ही योगा करता असं विचारलं तर ते म्हणतात, हा माझी पाठ दुखते, मला काही आसनं सांग बरं, माझी कंबर दुखते त्याच्यासाठी आसनं सांग, डोकं दुखते त्यासाठी आसन. So yoga is not yogasanas. So that's the first important thing we have to educate people, because yoga is चित्त वृत्ती निरोध. अनवॉन्टेड डोक्यातले जे विचार आहेत, इतके विचार म्हणजे, if you might have experienced this. Whenever you have a patient, there are some patients coming to you and you ask them, काय झालं? Okay, like you expect, you don't ask them like this, but the moment the patient comes in front of you, he tells, I am diabetic. He doesn't say, my name is Vikas or something. He says, I am diabetic. So that's what some people are so obsessed with their problems and diseases that they become a part of them, a personality. So it's very important. हे अशा टाइपचे मिसकन्सेप्शन योगाच्या बाबतीत पण. Yoga is no yogasanas. Yoga is more than yogasanas. And that's where we are going to understand what is it below the iceberg. And that's called as non-conventional approach. So this is non-conventional approach, ज्याला आपण म्हटलेलं आहे. पतंजलीजींनी त्याला अंतरंग योग म्हटलेलं आहे, because it is inside the water, so we don't see it. But that's where actually the most important power of yoga is. What do you find outside could be Bahiranga Yoga. Out of that, asanas is one important part. So to start with, the first non-conventional approach, what is very important is, whenever you have hypertension, diabetic patients coming to you, very, very important is you look into their eating habits. And as we have seen, Ashtahar Vidhi, all these 8 important factors which are being described in Ayurveda. We also have some important, beautiful things coming from yoga too. And that's called as the concept of mitahar, which is also there in Ayurveda in the form of matra, shiti and everything. But this is, which is most commonly missed part. The first important thing, I won't go into what to eat, what not to eat, patya, and all these things. But I want to just give you some simple kind of tips which can help your patients from getting into obesity. Because nowadays we have so much, everything in abundance, that every time we have so many options that we want to take the help of the dietitian to understand what to eat, what not to eat, when to eat, and all these things. So if you don't have a dietitian and you yourself want to understand, okay, you want to go for weight control or any of these kind of things, we too need to understand that we have 2 important dietitians with us. Okay. If we take their advice, I think most of the problems of obesity of your patients can be solved. The first is your fingers. Now, why your fingers is, we have always been eating with your hands. हातांनीच आपण जेवतो. पण हातांनी का जेवतो? कारण आपल्या बोटांच्या, at the tip of your fingers, we have the maximum number of neurons. Okay. म्हणूनच कोणाला समजा आपल्याला प्रेमाने काय हे करायचं असेल तर आपण पाय किंवा ढोपरा वगैरे असं नाही लावत, आपण हातांनी त्याला कुरवाळतो, जवळ घेतो. So fingers are the most important thing. And that's the reason you have to start eating with your fingers if you want to cut down your weight, or if you're feeling you're eating unwantedly. So once you start eating with your fingers, what happens is the neurons in your fingers start supplying the information, the sensations of the beautiful morsel of the food that you're eating to a part of your brain which is called as hypothalamus. Hypothalamus is the part which regulates your hunger. It has the satiety center. Okay. And so you are very much connected with your mind. आणि त्यालाच नवीन प्रकारचे एक जेवणाची पद्धत, माइंडफुलनेस ईटिंग अशा प्रकारे, आणि त्याचे फॉरेन मध्ये खूप सारे कोर्सेस पण आहेत, खूप सारे $, युरो खर्च करून तुम्ही मन लावून कसं जेवू शकता हे सांगितलंय. म्हणजे लाईक जे आयुर्वेदामध्ये म्हणलेलं आहे, तन मना भुंजित, हे जे सूत्र सांगितलंय त्याच्यावरती कोर्स पण आहेत आणि लोक खूप सारे पैसे घालून ते शिकतात पण. So that's something what happens when you eat with your fingers. If you don't use, you use spoon or something, बऱ्याच वेळा आपण बघितलं पण असेल आपले जीभ भासते किंवा काहीतरी भासतं. So that's because we are not able to be in touch. So first dietitian is your fingers, and the second dietitian is your tongue. You all might have experienced that the first food, maybe आता आपण पेस्ट्रीजचं उदाहरण घेऊ. पेस्ट्री आपल्याला खूप आवडतात आणि पहिला जो पेस्ट्रीचा आपण घास खातो त्यावेळेस एक छानसं काहीतरी एक फ्लेवर तयार होतो, एक गोड असं काहीतरी मनामध्ये एक छानशी संवेदना तयार होते. बट यू माइट हॅव ऑब्झर्व्ड की त्यात समजा 15-20 पेस्ट्री खाल्ल्या तर त्याच्यानंतर ती टेस्ट राहत नाही, काहीतरी विचित्र होते. तीच पेस्ट्री आहे, तीच चव आहे, पण आता चव बदलली आहे. So what is happening is actually your brain, your hypothalamus is trying to give instructions to your tongue, the receptors, that now you have to stop. The only thing is that कारण आपण टीव्ही बघत, मित्रांशी गप्पा मारत, बडबड करत, काहीतरी चालू असतं. So your mind is somewhere else, distracted. It's not in the food. And that's the reason we are not able to understand it. And so you find that because of your disconnect, you overeat. आणि तुम्ही कधी जास्त खाल्ला, ती चव कधी खराब झाली हे कळत पण नाही. So if you pay attention to your tongue, you are in connection with how the flavor is changing. The moment you find that the food is turning into bitter or जेवणाची चव जी आधी सुंदर होती ती आता गेलेली आहे, म्हणजे आता आपल्याला कमांड आलेला आहे. म्हणजे काय, तुमचं पोट जेव्हा भरायला लागतं, when your stomach starts filling in, you get a negative feedback mechanism to your hypothalamus that now you have to stop. And your hypothalamus asks your tongue to, hypothalamus converts the sensation into bland so that your hands stop eating. पण हे सगळं कनेक्शन होत नाही जेव्हा मन दुसरीकडे असतं, आणि म्हणून you tend to overeat and we get obese. Why are we discussing all these things? Because obesity is another reason why you get atherosclerosis. Your cholesterols get deposited in your blood vessels. Your arteries get choked up, and you have these kind of problems. Like 1 hour of a session for these kind of topics is something like becoming a BMS doctor in one day. So that's fine. We cannot touch each and every aspect. But these are some simple, important tips that definitely we can inculcate or talk with our patients and see. We can ourselves practice them, see if we can find any kind of changes, and then we can introduce. Because after all, at the end of the day, whenever you are going to give any kind of suggestions for yoga, the first thing is the patient is going to look into your eyes. Okay, and without even asking a question, you will be embarrassed, because that kind of gaze is what the patient is asking you. म्हणजे ते पंचकर्म करायच्या आधी पेशंट डोळ्यात बघतात, तुम्ही स्वतः कधी केलंय का? काढा प्यायच्या आधी तुमच्या डोळ्यात बघतात, काढा तुम्ही स्वतः पिलाय का, माहितीये का तुम्हाला याची चव कशी आहे? सो तशाच प्रकारे योगा जर तुम्ही दुसऱ्यांनी करावा असं जर कोणाला सांगितलं तर पेशंट तुम्हाला आधी डोक्यापासून पायापर्यंत बघतात आणि म्हणतात, आणि काही न बोलता तुम्हाला इतकं अनकम्फर्टेबल फील होतं. दॅट्स व्हॉट, अँड दॅट्स फर्स्ट इम्पॉर्टंट थिंग इज, इफ यू वॉन्ट टू ऍडवाइज समवन, इट्स व्हेरी इम्पॉर्टंट यू स्टार्ट प्रॅक्टिसिंग देम. And when you say you're practicing yoga, it is not necessarily you should be in a very great shape and all these things. It could be you can start with simple and not so rigid aspects of yoga. Okay, खूप ज्यांना फक्त शीर्षासन करता येतं तेच योगी, बाकी काही नाही आहेत असं काही नाहीये. So it's very important, because being a yogi is a state of mind, it's a state of your balance of your body and everything, and that is reflected. So even if you are obese or something like that, but if you are regularly into the practices of yoga, it is reflected. कारण तुमच्या चेहऱ्यावरती एक तेज असतं, डोळ्यामध्ये एक चमक असते, चेहऱ्यावर एक हास्य असतं, एक प्रकारचं एक हास्य असतं, and that denotes you are yogi. That doesn't mean that you have to very much all this kind of zero figure and all these things. So don't misinterpret these things, but practicing it, experiencing it every day is very, very important when you want to teach. As far as the diet is concerned, there are many other factors. They say in yoga, in Mitahar, there's a concept called as Chaturthansha Vivarjayat. Chaturthansha 1/4. So what is this concept? They say that 1/4 part should be empty. 1/4 part empty is also being given in Ayurvedic practices, that half the part should be filled with the food, 1/4 should be with liquids, and 1/4 should be left empty. आधीची जी मी टेक्निक सांगितली, हातांनी कसं जेवल्यामुळे किंवा जेव्हा तोंडातली चव खराब होते त्यावेळेस इट्स समथिंग विच गिव्स यू अन आयडिया की हाफ आणि 50%, 70% ऑफ द पार्ट इज फुल, अँड देन यू हॅव टू स्टॉप. इफ यू डोंट स्टॉप देन यू विल ओव्हर ईट, आणि मग आतमध्ये चतुर्थांश 1/4 जागा राहिले ती पण जागा फील होते आणि मग त्याच्यामुळे जेवण वरती आल्यासारखं, हायपर ऍसिडिटी सारखं होतं, हार्टबर्न सेन्सेशन होतात. अँड दॅट्स व्हॉट वी हॅव सीन. अ लॉट ऑफ पीपल हॅव हार्ट अटॅक्स आफ्टर फूड when they do some kind of physical activity. म्हणजे जेवल्या जेवल्या झोपणे किंवा जेवल्यानंतर काहीतरी हेवी काम करणे, जेवल्यानंतर रात्रीच्या वेळी हार्ट अटॅक्स अशा प्रकारचे येतात. सो दॅट इज समथिंग विच इज अगेन व्हेरी इम्पॉर्टंट. आफ्टर डायट देर शुड बी अ गॅप ऑफ ॲटलीस्ट 2 to 3 hours between your sleep and your dinner. So that's again something what you can recommend. खूप तुडुंब जेवायचं नाही. इनफॅक्ट आपण मराठीमध्ये जो शब्द यूज करतो सावकाश, that's a misinterpretation. It's coming from the root, from the Sanskrit word. Okay. So Savkash is mostly like Sa and Avkash. Avkash means space. So whenever you are inviting a guest and asking him to eat, you're saying that Savkash Jeva, you're actually, people feel like you're asking them to eat slow so that you can eat more. But in fact, the true meaning of that is Sa Avkash. म्हणजे इतकं जेवू नका की नंतर तुम्हाला त्रास होईल. ओके. इतकंच जेवा की जेवल्याच्या शेवटी तुमच्या पोटामध्ये 1/4 जागा शिल्लक राहील. म्हणजे इनफॅक्ट तुम्ही कमी खायला सांगताय की जेणेकरून त्यांचं आरोग्य चांगलं राहील. सो दॅट इज अ काइंड ऑफ mindset that we have. Vasudhaiva Kutumbakam. Okay, we always feel that everybody should move ahead, prosper, and be healthy and wise. And that's the true meaning of Savkash, not we generally interpret. Okay. Every slide can be talked about like for hours together, but many aspects can be done. Like for example, um, for the health of the eyes, that's also very important. A lot of times it happens like even though you have hypertension, in hypertension also it has been found out that you have the problems of retinopathy and all that. So you have different practices there. You would be seeing like you have the Tratak, candle gazing. Okay, those who don't know Tratak is like without blinking your eyes, you have to look at a particular object. So along with that, simple practices in your daily things, like for example पादाभ्यंग, पाय तळव्याला तेल लावल्यामुळे पण डोळ्यांचं आरोग्य चांगलं राहतं. सेकंड थिंग इज वी हॅव सम स्मॉल आय वॉश कप्स किंवा असे स्मॉल छोटे छोटे कप्स ज्याच्यामध्ये जस्ट तुम्ही पाणी घ्यायचं आणि डोळे त्याच्यामध्ये बुडवायचे असे. And you have to open your eyes in the water and look up and down, left and right. We can have such kind of practicals maybe later. So such kind of simple things can be taught in the far of dinacharya is concerned. When you wake up, that's again important. When you go to bed, again very important. Now, what at most of the time what happens is we have our dinner late, and then after dinner immediately we watch TV. But TV बघता बघता nowadays we have the Amazon Prime and all these things. मग एक सीझन चालू झालं तर मग नंतर इतकं ते लांबतं की नंतर झोपेचा टाइम निघून जातो, मग झोप जाते, डिस्टर्ब होते. And then what happens is in that kind of 1-2 वाजता, रात्रीच्या 1-2 वाजता मग लोकांना भूक लागते, because that is the time of pitta period. So because of this kind of craving, you snack something. अशा ऑड टाइमला काहीतरी तळलेलं काहीतरी स्नॅकिंग केल्यामुळे झोप तर गेली. रात्रीचं जेवण झाल्यानंतर इथं पूर्ण युअर ऑल इंटरनल डायजेस्टिव्ह सिस्टम, लिव्हर, एव्हरीथिंग आर ट्राइंग टू रिज्युनेट. त्यामध्ये त्यांना रात्री उठून, म्हणजे ते असं झालं की तुमच्या आईला रोज रात्री उठून 1 वाजता 2 वाजता स्वयंपाक करायला लावण्यासारखं आहे. शी विल बी इरिटेटेड. सो द सेम थिंग हॅपन्स विथ युअर डायजेस्टिव्ह सिस्टम ऑल्सो. सो in this way, kind of eating something, snacks at the late night, then you tend to sleep late. You wake up in the time of kapha period, like around 9-10. Okay, so the vata period is gone, your digestion is incomplete. मग त्याचे गॅसेस वगैरे तयार होतं. पुढे जाऊन सकाळी उठल्यावरती डोकं जड असतं, ऍसिडिटी. एव्हरीथिंग, द होल ऑफ द सायकल इज डिस्टर्ब. सो दिनचर्या आणि ऋतुचर्या, दे आर व्हेरी इम्पॉर्टंट ऍस्पेक्ट्स. जितक्या बेसिक गोष्टी जरी आपण फॉलो करता येऊ शकल्या, पेशंट्स need to be told about these things. They have to be advised. They have to be made aware of how these small things affect their health. And overall, if they are having family history of heart diseases, and if they are already having some other complications like diabetes or hypertension, then definitely they have to be very more careful. Like most of the time, diabetic patients die at night without having any symptoms. That's a very dangerous part. When you have heart attack for a diabetic person, normal person can have sweating, chest pain, all these kind of symptoms, giddiness. They can make the person aware. He might go into hospital and get management for that. But diabetic person doesn't get any kind of symptoms, because we have seen retinopathy, neuropathy, all these are different kind of problems because of which the sensations are very less, and then these people expire. And so all these small activities in Dinacharya, like taking care of your eyes, yeah, can also prevent in the complications of hypertension, like retinopathy and all these things. And things can be better for the people. As far as achar is concerned, we have seen how mindful eating and all these activities are very important. The simple things like yama niyamas. Again, yama niyamas are a very neglected part as far as yoga is concerned. Yama niyam म्हणजे फक्त ते आपण पाठ करतो, 5 यम सांगा, 5 नियम सांगा. That's all. But most of the time in our day-to-day life, we do not use it much for a regular practice and all this. But there is some research. One research talks about like, they say that people who resort to violence, म्हणजे खूप काही लोक असे आहेत की प्रत्येक सिग्नलला प्रत्येक दिवशी ऑफिसमध्ये भांडणं, ओके, असे ज्यांना भांडणं करायची घरामध्ये इकडे तिकडे सवय आहे छोट्या छोट्या कारणांवरून, किंवा लोकांना खोटं बोलायची पण खूप सवय असते. सो वन रिसर्च सेज दॅट पीपल हू रिसॉर्ट टू व्हायलन्स अँड पीपल हू स्पीक अ लॉट ऑफ लाईज, कारण एक खोटं बोलल्यावरती ते लपवायला अजून एक खोटं बोलायला लागतं, मग ते अजून एक खोटं, आणि हे खोटं बोलण्यासाठी अ लॉट ऑफ एनर्जी इज बीन स्पेंट ऑफ युअर बॉडी. So a lot of cortisol has been secreted. You go into sympathetic mode, and that we know all these things. या सगळ्यांचा त्या रिसर्च मध्ये असं सांगितलेलं आहे की असे जे लोक आहेत जे सारखं खोटं बोलतात, भांडणं करतात, तर त्यांना, ओके, these are the people who are they say that their chances of getting heart attack increases by 72%. Yeah. So heart disease is directly related with, with fighting, speaking lies. And what is fighting? It is hinsa. What is speaking lies? It is asatya. And what is opposite to that? It's being given in yama. What is that? Ahimsa, satya, आणि मग पुढे आस्तेय, ब्रह्मचर्य, परिग्रह. So all these are yamas. पण कधी आपण हार्ट अटॅकच्या किंवा कार्डियक हेल्थच्या दृष्टिकोनातून कधी यमन यमनकडे बघितलं पण नाही. आणि ते कधी आपण अशा प्रकारे खूप डिटेलमध्ये जाऊन प्रत्येक पेशंटची केस घेताना त्याच्याशी काउन्सिलिंग करणं. Counseling is something which is definitely a no-no nowadays in this busy world, because we want to have not a general thing, not like nobody does it, but normally the new generation, or most of the time, we feel that it's easy for us to give some kind of churna path, some kind of treatment to every illness. It's easy for a yoga teacher to prescribe some asanas for every patient. या सगळ्या गोष्टी सोप्या आहेत. दॅट्स व्हॉट वी से. वी कंप्लेन अबाउट ॲलोपॅथिक डॉक्टर्स, बिकॉज दे फाइंड इट व्हेरी कम्फर्टेबल. काही झालं, पेशंटचं खूप जास्त ऐकून न घेता लगेच गोळी लिहून द्यायची, बस संपलं. टेन्शन आहे म्हटलं लगेच झोपेची गोळी. पण टेन्शन काय येते ह्याचा विचारच करायचा नाही. सो आय थिंक सच काइंड ऑफ शॉर्टकट्स आर the reasons why later on we have to pay a heavy price. We, in the sense, we along with the patients. Ultimately, the patients has to suffer. So if we try to get into these aspects of yoga, which are not regularly being emphasized on, I think we can create more difference, more benefits, rather than only focusing on some typical physical aspects. Yeah. So what exactly happens is, when you are focusing on these yama niyamas, you are working on the HPA axis. You are re-establishing the balance between the hypothalamo-pituitary adrenal axis. Ultimately, the immune system also increases. Every yama niyam is so beautiful that we can understand how in our day-to-day life we are actually, we are so much obsessed with these things, whether it is promotion, whether it is your growth as far as your financial turnover is concerned. Mas 1 BHK, there 2 BHK paije, 3. There's no end for it, and it's not like it's a need. We don't understand when the need has become a hunger, okay, or a greed. Okay, so these kind of things are the ones that really create a lot of amount of stress in us. Yeah, and that is something. Excuse me. Yeah. So this kind of greed somewhere exceeds in our life, and we, in the race of comparison, we don't understand when we have crossed our line, our limit, and we feel that we compare ourselves with our colleagues, with our people around us. We don't understand what are our strengths, what are their strengths, what are our weak areas. And that's the reason unnecessarily We get up into a too much amount of stress. We make our lives complicated. We are not able to enjoy the present day. We are not able to enjoy the present moment. And these kind of practices are the ones that lead to the complications. Someday you get heart attack, and maybe that's the day when you realize how important these small moments were all about. Yeah. So your activities, achar, is also very important, which are yogic counseling, understanding why a person is under stress, why a person is smoking, why a person is drinking alcohol. All this thing is a part of yogic counseling part. Most of the time, your patient is not motivated himself. जर पेशंटला असं वाटत असेल की इफ यू स्पीक विथ अ अल्कोहॉलिक पर्सन हु सेज काय डॉक्टर तुम्ही मरणार नाही का, तर तुम्ही पण मरणार आहे, मी पण मरणार आहे, मग मी दारू पिऊन मेले तर काय वाईट आहे. सो दिस काइंड ऑफ एक्सप्लेनेशन्स आर बीइंग गिवन. सो व्हेन डू वी हॅव सच काइंड ऑफ एक्सप्लेनेशन्स इज व्हेन द पर्सन इज नॉट मोटिवेटेड इन लाईफ. त्याला आयुष्यामध्ये काय करायचं हे माहीत जेव्हा नसतं त्यावेळेस अशा प्रकारचे एक्सप्लेनेशन्स आहेत. ज्यावेळेस लोक ध्येयवादी असतात, ज्यांना काय आयुष्यामध्ये करायचंय, लोकांसाठी काय करायचंय, आपण आयुष्यामध्ये काही मोठं व्हावं असं काहीतरी वाटत असतं, ते त्या दृष्टिकोनातून प्रयत्न करत असतात. सी इट्स नेव्हर लाईक बीइंग टोल्ड इन योगा दॅट यू हॅव टू बी एमलेस. बऱ्याच वेळा कर्मयोगाचा खूप वेगळ्या प्रकारे अर्थ काढला जातो. ओके, इफ यू से यू आर अ योगी, मग तुम्हाला पैशाची काय गरज आहे, मग तुम्हाला फी कशाला पाहिजे, तुम्ही तर कर्मयोग करा, फळाची अपेक्षा करू नका, असं म्हणून काय काय लोक लाईक दे ट्राय टू प्ले अराउंड यू. बट दॅट इज नॉट व्हॉट कर्मयोग इज. कर्मयोग इज जेव्हा मी पेशंट बघतोय, जेव्हा मी योगा करतोय, त्यावेळेस मी त्याचाच आनंद घेणार. ओके, व्हेन आय एम टीचिंग योगा आय विल एन्जॉय व्हॉट आय एम टीचिंग, बट व्हेन इट इज डन डेफिनेटली आय विल ऑल्सो एन्जॉय व्हॉट इज एक्सपेक्टेड, what I am expected to get. So asha prakare it's don't allow someone to play with you just because you are a yogi. Okay, yoga never talks that you have to be aimless in life. You definitely have to have your aims and higher purposes, and these are been described somewhere as chaturvid purushartha. म्हणजे धर्म हा एक महत्वाचा भाग आहे, पण काम is also an important part of our life. त्यामुळे धर्म मी योगा शिकवतोय हा माझा धर्म आहे, पण त्याचा आनंद पण मला मिळायला पाहिजे. सो being paid for it, karma, is also something which is being taught in my scriptures. At the same time, we also have to understand त्याचा अर्थ. ओके, अर्थ पण मिळाला पाहिजे, त्याचा मोबदला पण मिळाला पाहिजे. आणि अर्थ नेहमी पैशाच्या बाबतीमध्ये नसतो. अर्थ कधी कधी इट्स ऑल्सो लाईक व्हॉट व्हॅल्यू ऍडिशन यू आर डुईंग टू युअर पेशंट. सो दीज आर डिफरंट ऍस्पेक्ट्स that we have to make our patients understand. If your patient is not life motivated, म्हणजे आयुष्यात करायचं काय, सकाळी उठल्यावरती डोळे उघडल्यावरती मग काय करायचं, मग स्वयंपाक बनवायचा, मुलांना डबा बनवायचा, बिकॉज आपण काय करायचं तर शटर उघडून दवाखान्यात बसायचं, शटर बंद करायचं, रात्री घरी यायचं, जेवायचं, झोपायचं. व्हॉट एक्झॅक्टली इज दिस रिअली ओनली माय पर्पज, or in this process it's not like something is bad, this is good, but is this only, or I have to give something more, is my purpose something more? So if you don't give this kind of perspective, life goals to your patients, then what will happen is एक दिवशी मग तेच ही ऍक्टिव्हिटी आपण रोज करतो ना, रोज दवाखान्यात जातो, पेशंट बघतो, संध्याकाळी घरी येतो, आणि मग नंतर एक दिवस आपल्याला वाटतं, एखाद दिवशी पेशंट आले नाही, एखाद दिवशी पेशंट काहीतरी वाईट बोलून गेले, आपल्याला असं वाटतं की काय आय डोंट लाईक प्रॅक्टिसिंग, आय डोंट लाईक बिंग अ डॉक्टर, हे काय आपल्याला आवडत. सो दिस हॅपन्स बिकॉज वी डोंट अंडरस्टँड दॅट एव्हरी डे व्हॉट वी आर डुईंग इज फॉर अ हायर पर्पज. सो ते हायर, ते जे काही गोल आहे तो आपल्या आयुष्यामध्ये बनवायला पाहिजे. जर पेशंटनी बनवला नसेल तर तुम्ही त्याला बनवायला मदत केली पाहिजे. सो दॅट इज ऑल्सो योगा. ओके, and ultimately in the life goals, the last part is being told as vairagya, that is called as moksha. म्हणजे शेवटी it's not bad to have a 3 BHK, a villa, or maybe a chopper. No, it's good. Okay, you have to do it. How you do it is also important. Okay, but when you have that villa, that chopper, or any kind of power in your life, what is more important is one day this chopper is going to go away, one day this villa is going to go away. किंवा मी जर सुंदर दिसतोय तर हे सौंदर्य पण एक दिवशी जाणार आहे. तर मग काय, तर आजपासून प्रत्येक क्षणाक्षणाला ते गेल्यावरतीही मी किती शांत राहील, स्टेबल राहील, ह्याची तर जर तयारी तुम्ही आजपासून केली नाही तर तुम्हाला ज्या दिवशी तुमच्या हातात सत्ता राहणार नाही, ताकद राहणार नाही, ज्या दिवशी तुम्ही ओल्ड व्हाल, कारण दॅट इज व्हॉट शीर्यते तत् शरीरम. नो, द बॉडी इज गोइंग टू डिजनरेट वन डे, अँड वी नो दिस. Okay, but still in Ayurveda we see to it how we can slow down the process. We don't say that we are going to stop the process. Okay, So in this slowing down, every time when you are repeating the word sharir, you are reminding yourself that this is going to happen. So Vairagya Bhav is very important, and that has to be developed in your patient. Otherwise, you overestimate, म्हणजे तुम्ही खूप काहीतरी भलत्या सलत्या आश्वासन देऊन टाकता पेशंटला, मी तुमचं हे बरं करेल, ते बरं करेल, पण तसं होत नसतं. Yoga also is not made for health. Ultimately, it is made for moksha. So you have to prepare your patient for these aspects of life, and then definitely people can enjoy yoga. And then you don't need to force them की आज का नाही आला रे, आज मग सूर्यनमस्कार का घातले नाही, असं म्हणायची गरज नाही पडणार, because they are ultimately very motivated and they don't need anyone to tell them what to do and what not. Next is the conventional aspect. I actually, frankly speaking, I didn't get much time to add a lot of things, so my PPT is very dull and boring. But still, as far as the conventional part is concerned, there are some researches which have been talked about. For example, the conventional aspects, Surya Namaskar, Asan Pranayam, या सगळ्या गोष्टींनी काय होणार आहे हार्ट पेशंट्स मध्ये. तर फर्स्ट थिंग इज यू आर टेकिंग केअर ऑफ देअर वेट मॅनेजमेंट. म्हणजे जेव्हा तुम्ही सूर्यनमस्कार करणार आहात, भुजंगासन करणार आहात, अर्धमत्स्येंद्रासन करणार आहात, या सगळ्या गोष्टी. अँड इट्स नॉट नेसेसरी की हार्ट अटॅक झाल्यावरतीच या सगळ्या गोष्टी सुरू करायला पाहिजेत. इट्स ऑल्सो इम्पॉर्टंट दॅट योगा कॅन हेल्प यू इन अ प्रिव्हेंटिव्ह ऍस्पेक्ट. अँड मी कुठेतरी असं बघतो की नॉट ओनली इन डॉक्टर्स बट इन जनरल पॉप्युलेशन, जर तुम्ही म्हटला की चला योगा करूयात, तर प्रत्येकाचा अप्रोच असतो मला काय झालंय, म्हणजे झाल्यावरतीच मी योगा चालू करणार. ओके, आय डोंट हॅव मच पीपल गिव्हिंग अ लेक्चर योगा फॉर प्रिव्हेंटिव्ह हेल्थ, योगा फॉर प्रिव्हेंटिव्ह कार्डियाक हेल्थ. आय ऑलवेज सी पीपल गिव्हिंग लेक्चर्स योगा फॉर कार्डियाक डिसीज मॅनेजमेंट. Why do we have this kind of an approach? Always you have to make the disease and then we will come as Superman or Spider-Man to save people. I think this approach of us is wrong and it's a kind of criminal approach. म्हणजे वाट बघत बसायची आणि then. So I think we should be confident enough that I will work only in the preventive aspect. I will see to it that nobody goes into heart attack and then they need my help. So, and that's, I think, is the key secret. All you are youngsters, third year. So before you get into your practice, I feel that patients and diseases are just 5% of the total population. Rest 90-95% are healthy people. Okay. If you really want to grow and be millionaires, rather than focusing on those 5-10% who have diseases, and I think all the doctors are getting into helping those 5-10%. I think you should take the responsibility to help the remaining 90% who are actually healthy, so that tomorrow they won't get into the complications of heart diseases, complications of diabetes and all these things. So preventive yoga is something which is key, and tomorrow the future of yoga and the future of healthcare is going to be preventive aspects. So if you really are interested and you want to take the risk, and because after all there's a risk, okay, तुम्हाला आयुष्यामध्ये जर फक्त असं वाटत असेल की हे नाव दॅट आय हॅव 90%, आय हॅव द की सिक्रेट, आणि ह्याच्यात सगळेच गेलेले एकदम फायनान्शियली सक्सेसफुल होतील, तर असं नाहीये. ओके, देर इज अ रिस्क ऑल्सो इन्व्हॉल्व, बट डेफिनेटली देर इज सॅटिस्फॅक्शन अँड हॅपीनेस दॅट यू आर डुईंग समथिंग गुड. So if you really want to take that risk, definitely preventive health is very beautiful and important. So preventive health, preventive yoga has considered to be important in reducing the BMI, waist circumference. So obesity management is through which you are helping cardiac patients. Controlling the systolic and diastolic blood pressure. So hypertension management is helping cardiac patients. Developing control. Okay, we have exceeded the time limit. So yeah. So these are the different aspects that we are going to focus. That's what yoga actually helps. As I talked about, it reduces the inflammation and endothelial dysfunction. Okay, we have seen the inflammation signs: calor, rubor, dolor, tumor, functionalessa, and that's what is inflammation? Functionalessa, lack of function. That's again imbalance. Okay, so what is yoga? Samatvam yoga uchyate, the balance of life. You're restoring the balance. And how can you restore the balance of the endothelial dysfunction? Is when you restore the balance in your mind, ultimately you restore the balance of the cells of the endothelium. And that's how deep the psychology and philosophy of yoga is. But still we have a lot of researches. You can take the benefits. In 2018, this research talked about is just 30 minutes yoga per day. We'll see what are the yoga practices. They can reduce your blood pressure, systolic by 10 and diastolic by 8. What are the different Shuddhi Kriyas, as I talked about, for the retinopathy problems and for health of the eyes? You can have for Tratak. You have Neti, Kapalabhati. Tratak is also very important because this aspect of Tratak is not understood most of the time. Gazing is not only good for the health of the eyes, but it's also important because when you keep your eyes open, when you don't blink, you're controlling your ciliary reflex. And the light rays which are going constantly inside your eyes stimulate your retina. Yeah, and when your optic nerve is carrying the light signals to your brain in the pathway, it also influences your limbic system. And it is this influencing your limbic system. Limbic system is the center of balance of your emotions. Slowly and gradually, when your limbic system is strengthened, you feel more calm, relaxed, and balanced. हेच तर बघतो आपण कार्डियक हार्ट पेशंट्स हायपरटेन्शन ब्लड प्रेशर वाढलं माझं इतकी चिडचिड केली की ब्लड प्रेशर वाढलं so that's what you want to do. You engage patients into Tratak not only for your health of the eyes but slowly and gradually you will find a change in the attitude also. That's how yoga practices work. But the most important part is Dirgha Kal. It has to be done long term, Nairantar, daily, and Satkar Asevito Drudbhumi. This is the sutra of Patanjali about Abhyas. You have to believe in the practices that you do. म्हणजे पतंजलींनी पण सांगितलंय की जर तुम्हाला रिझल्ट फास्ट पाहिजे असतील तुमच्या योगा थेरपीचे तुमच्या ट्रीटमेंटचे तर ते म्हटले what he talks about the sutra, I just forgot the sutra, that's fine, but the sutra says that a person who really desires to get the benefits earliest is the one who is going to get it fast. Next is the practices of Sukshma Vyayam. So there are different kind of Sukshma Vyayam practices we will related with your different joints, especially your shoulder joint, your neck joint, your low back, so hip joint. So these joints are being used as Sukshma Vyayam. They help in reducing the stiffness. It also has a good amount of positive benefits on improving your exercise tolerance. You have different kind of asanas. And in these asanas, more of the emphasis should be on the Shavasana and Makarasana like relaxation practices. Because this is the one which is very important in slowing down your sympathetic system. Along with that, when you're doing these practices, you can focus on abdominal breathing. So when you're doing abdominal breathing, you can practice the Makar chanting. And this Omkar sadhana can have a great amount of influence. Yoga practices have reduced the risk factors for cardiovascular diseases. Especially good benefits have been found out even in reducing insulin resistance in type 2 diabetic people. So everything is interlinked, and that's where the problem arises when initially when the patient starts, he feels that this is he and this is how the instructor is, and he tries to have a competitive attitude, judgmental attitude, and that is where he gets caught up, like that is where he gets frustrated, he leaves the yoga class. So it's very important you make him understand that yoga is completely non-judgmental. Okay, don't try to compare one student with another, don't try to criticize someone, because after all yoga is samatvam yoga uchyate. You are trying to achieve a balance. Yeah, it's chitta vritti nirodh. Trying to reduce the unwanted thoughts is the key. So somebody can do it in Pavan Muktasan, somebody with the releasing of the gases, somebody can do it in Vrukshasana, somebody can do it in meditative simple Sukhasana. So all these are different instruments. The way for an artist, what is important is not the brush, the paint, the canvas. What is more important, the artist himself. So here in yoga, Surya Namaskar, Asana, Pranayam are like brush, paint, stroke and canvas. But what is important is the artist. So the patient who is involved in the practice is more important than the practices themselves. So never let your practices overpower, and make the patients understand that everything that they are doing, just try to enjoy it, be mindful, they can have the benefits of the same. As far as the pranayam practices are concerned, you have this screen. You can just take, I hope this slides will be there for you. I will just update the slides and share it to you so that you can go through it. We have also seen how nitric oxide, when you practice Brahmari pranayam, is helping a lot of people in the COVID times. The nitric oxide which is produced with Brahmari is 15 times more than the normal exhalation. Another beautiful thing is, there's a sutra in yoga that called about Prachardan Vidharanabhyam va Pranasya, which means how to keep your mind calm and relaxed. That is the sutra of Manasthiti Nibandhani in Yoga Sutra. So they say they have derived this formula for management of hypertension. If you want to reduce the left ventricular hypertrophy, what is important is prachardhan, exhalation. When your exhalation is more than inhalation, vidharna is, even the kumbhak is not important, but prachardhan, that is exhalation is important. So research has shown that longer exhalation relaxes the sympathetic nerves and it improves the left ventricular output, and it reduces the hypertrophy also. So it's good in diabetic patients, reducing the heart problems. So many important things are there. It's very deep, very beautiful. I'm very happy that you have given this extra amount of time for me, and great to have this kind of interaction with the young minds of tomorrow and the future health of the country. So thank you very much. Namaste.
Thank you, sir. Thank you so much for such a wonderful, informative lecture.
Thank you.
मुलांना विचारायचे कोणाला काही प्रश्न?
Hello, ma'am.
हाँ बोल.
May I ask a question to sir? Hello, sir.
Yes, namaste. Yeah, please, Rishikesh ji.
So myself Rushikesh. Sir, I have watched many videos about the Chandra Nadi, sir, which is compared to the parasympathetic nervous system of the modern science.
Mm-hmm.
So, sir, they compare it to the parasympathetic nervous system, the Chandra Nadi, also called vagus nerve, sir. So, sir, is it really true? Is it really worthy saying that performing the pranayamas and longer the exhalation, that is directly going to affect your parasympathetic nervous system, which will calm down your mind? Is this true, sir?
Yeah, absolutely. Yeah. But the thing is, what you said in the first part was, comparison is something which is quite difficult, because I think apple and pears cannot be compared. म्हणजे वजन आणि उंची या दोघांमध्ये कंपॅरिझन कशी करायची हे मला अजून पण कळलं नाही. म्हणजे वजन असणार आहे ते किलो मध्ये असणार आहे. ओके, आणि उंची म्हणजे तुम्ही एखाद्याची उंची किलो मध्ये कशी मोजणार? अँड दॅट्स द रिझन व्हेन वी ट्राय टू कम्पेअर चंद्र नाडी, ओके, नाडीज विथ नर्व्स अँड ऑल दिस थिंग्स, इट्स व्हेरी चॅलेंजिंग. म्हणजे ते तसं इक्वल टू नाही होऊ शकत, पण आता ज्याला काहीच समजत नाही त्याला आपण सांगायचं कसं? ओके, सो आता समजा मला मराठी इंग्लिश कळत नाही, मला फक्त चायनीजच कळतं, तर तुम्हाला मी कम्युनिकेट कसं करणार जे काय मला सांगायचंय? तर मी काहीतरी मधला मार्ग शोधणार, ते म्हणजे साइन लँग्वेज. मग असं करणार, असं काहीतरी करणार की जेणेकरून आपण दोघं कम्युनिकेट करू. पण ती तेवढी ऑथेंटिक असणार का? नाही असणार, कारण साइन लँग्वेज मध्ये बरेचसे लिमिटेशन आहेत. पण तर ठीक आहे, काही नसण्यापेक्षा मी चायनीज बोलतोय, तुम्ही काय मराठी आणि इंग्लिश बोलताय, तर दोघांमध्ये काहीतरी थोडंफार आपण जुगाड करू शकतो. तर तसा तो जुगाड आहे. And I think it's far more better that we try to understand them in it. We try to understand yoga in the yogic perspective with the yogic terminologies. And if you want to take the help of the modern science, then you can just take the help just for a grasp. मग त्याच्यामध्ये डिबेट करण्यात काय तसं काय खूप पॉइंट नाहीये, because they are completely quite different. So it will be very difficult to say, because nadis are not nerves. Okay, they are not plexus. बरेच वेळा चक्रांना प्लेक्सिसशी कंपेअर केलं जातं. दॅट्स अगेन द थिंग. नाडी इज अ स्पिरिच्युअल पाथवे, म्हणजे ज्याला आपण ऍक्सिस म्हणतो, HPA ऍक्सिस म्हणतो, हायपोथॅलॅमो पिट्युटरी ॲड्रिनल ऍक्सिस आहे. पण त्याचे काय मध्ये काय अशी नर्व नाहीये की हायपोथॅलॅमसला पिट्युटरीशी जोडले, पिट्युटरीला ॲड्रिनल ग्लँडशी जोडले, असे जोडलेलं नाहीये ते. दॅट्स अन ऍक्सिस. सो तसेच नाडीज इज अन ऍक्सिस. इट्स अ hypothetical concept. It is not there in an anatomy. If you dissect a person, you won't find nadis and chakras. So त्या conceptला तुम्ही आपण असं नाही करू शकत. We cannot say it, compare it directly with the vagus nerve, parasympathetic nervous system, not directly, but yes, it has its role, and it is what you find in the modern science can be correlated, but it cannot be equal to.
Okay, and so same way they said that Pingala Nadi, that is the right nostril, is Surya Nadi, and left Ida, that is the Chandra Nadi. So can you please explain how does our breathing affect our nervous system with these through these two nadis? How is the mechanism?
Okay. Yeah. So there's a sutra in Patanjali, in Hatiyok Pradipika. So that sutra is it talks about Chale vate chale chittam nischale nischalam bhavet. Yeah, this particular sutra gives the correlation that how prana or vata has a great amount, or the thoughts have a great amount of influence on your breathing pattern. So before we, whenever we see that we are in a very aggressive state, or maybe we are in an emotional upset and all these kind of things, or in emotional turmoil, you will find that most of the time our respiration is very fast. Your respiratory rate has gone up, your heart rate has gone up. Okay. So in this dimension, whenever you try to introspect and see that whenever you are calm, you're relaxed, your respiratory rate is very calm and relaxed. So this is what is being assessed as far as the pranayama is concerned. If your normal respiratory rate is maybe 16, 17 per minute, you will find that whenever you are practicing pranayama with the Pura, Kumbhak and Rechaka, all these kind of aspects. So you have the yogis who breathe only maybe hardly once or twice a minute, or maybe after every 2 to 3 minutes, because if you do it in 1:4:2 ratio and you have a good amount of kumbhak, all these practices, then you hardly breathe even once a minute. So when you are able to bring down your respiratory rate to this amount of level, you are there are many mechanisms. Like for example, you are getting into respiratory acidosis inside the hypothalamus of your brain. What are you doing is you are kind of stimulating your respiratory center, which is creating a kind of negative mechanism to your alveoli. You are starving your alveoli to have more amount of oxygen. जसं एखाद्याला जरा उपाशी ठेवलं आणि मग जेवायला दिलं तर तो जास्त खाणार, पण ज्याचं पोट भरलेलं आहे त्याला जर किती जरी जेवायला दिलं तर तो खाणार नाही. सो व्हेन यू आर डुईंग द कुंभक, when you are holding your breath, doing the retention pranayam practices, what happens is you are starving your alveoli of that with more amount of time. म्हणजे समजा तुम्हाला खूप सगळं अनलिमिटेड खाऊ शकता पण एका मिनिटातच खायचंय, तर यू कॅनॉट हॅव एव्हरीथिंग. अनलिमिटेड जेवण आणि 1 तास वेळ दिला तर भरपूर खाऊ शकता. So when you are doing the kumbhak, that time is also given to your alveoli for this kind of gaseous exchange to take place. And that is the reason why you have these kind of positive beneficial effects as far as mental relaxation and stress management is concerned. Because ultimately, whenever you have the sympathetic trigger, what you have is your body needs more amount of oxygen, your body needs more amount of glucose, and all these things are being full. They need more amount of insulin. So the process of glyconeogenesis takes place. All these systems and all these neurotransmitters are flooded. So when you are able to practice these kind of pranayam practices and you calm down your respiratory rate, all this slowly and gradually goes down. It's like,
okay. Thank you, sir. Thank you very much for the perfect answer.
Thank you so much, sir.
yes, thank you very much. And
थँक्यू सर. चिकित्सेचा भाग तर तुम्ही सांगितलाच, सगळे कार्डियक डिसीजेस एक्सप्लेन केले. मला वाटतं आईसबर्ग फेनॉमेनॉन मुलांना जास्त आवडलेला दिसतोय. म्हणजे योगाचा फक्त आसन हाच एक भाग नसून बाकी अंतरंग योग सुद्धा तितकाच महत्वाचा आहे, हे चांगलं पटले. आणि दैनंदिन जीवनातल्या तुम्ही ज्या छोट्या छोट्या गोष्टीची उदाहरणं दिली ती खूपच छान होती, अगदी मनाला पटलेल अशी. तर मला वाटतं सगळ्यांच्या शंका संपल्यात का? कोणाला विचारायचं अजून काही? ओके, थँक्यू सर. सर उद्या परत आपल्याला भेटायला येणारच आहे. उद्याचा टॉपिक असेल स्ट्रेस अँड इन्सोमनिया. सो आपण आपला हो सर चालेल.
So make yourself comfortable, back straight, eyes closed, holding your palms. Inhale deep. Sahana bhavatu sahanau bhunaktu saha viryam karvavahai tejasvinavadhitamastu ma vidvishamvahai. Om Shanti Shanti Shanti. Place your warm palms on your eyes. Slowly open your eyes, then close palms. Take your warm palms down. Namaste and welcome everyone in you. Thank you.
Thank you so
Thank you,
much.
Madam. Thank you, sir. Yes, thank you, everyone.
Thank you.